Next speaker is Dr. Bevra Hahn. Bevra is professor of medicine and the chief of division of rheumatology at UCLA. She's also vice chair for faculty affairs. She received her bachelor's degree at Ohio State, her medical degree at Johns Hopkins. She then did internal medicine residency and internship at WashU, and then was a fellow at Hopkins. She came back to WashU and then left to go to UCLA, where she is at present. She's been on the editorial boards of a number of journals. She's been listed in the Best Doctors in America, recipient of the gold medal from the American College of Rheumatology in 2009. She's been president of ACR. She has over 150 peer-reviewed journal articles, nearly 100 book chapters, review articles. She's a co-editor of the lupus textbook, and she's going to talk today about accelerated atherosclerosis in lupus. Bevra.
So I want to do a bit of an overview of atherosclerosis for you, and I'm going to focus it mainly in lupus because that's what I'm working in and I know most about that. And I'm going to show you some of the data that we've accumulated and suggest that there are some biomarkers other than the standard ones that are really more sensitive for patients who are at risk for this. And then I'm going to finish up with a discussion of should we or should we not be giving statins. So let's go ahead, and this is the approximate increased risk for atherosclerosis in the various rheumatic diseases. And I've taken this out of multiple papers that I've annotated for you there. So the risk is highest in lupus, where it's somewhere in the 6 to 10 range. This is an average of Western Europe and the United States and Canada. Rheumatoid arthritis, it's about threefold, and the patients are older when you start, so they're more likely to have comorbidities that predispose them as well. And in the psoriatic arthritis, ankylosing spondylitis, it's a little less than 2, but it's definitely elevated, and this is the healthy 1.0. So now when we look just at lupus and we look at atherosclerotic events, and that's what I was talking about in the other slide, there are several little pearls about lupus. So the patients who are at greatest risk are women who are between the ages of 35 and 44, here in this gray bar, and there's a study from an epidemiology group that shows that there's a 50-fold increase risk of a cardiac event, or coronary artery disease actually, in lupus women in this age group. So these are mostly premenopausal, unless you've been giving them a lot of Cytoxan. For MI in patients who are not obese, it's about a 10-fold increase, and for death from coronary artery disease, there's about a 20-fold increase in lupus patients overall. And this is risk for stroke, so it's also somewhere between 8 and 10-fold higher. This is a little more complicated. Some of our strokes are atherosclerotic, but there's a major role in here of antiphospholipid antibodies, which seem not to be so important in this subset of lupus patients who get coronary artery disease, but very important in the stroke subset. So now, how often can you, here are the traditional Framingham risk factors, and how often do they explain the increased risk for atherosclerosis in lupus? So after you control for age, sex, cholesterol, hypertension, diabetes, and tobacco use, you are left still with a relative risk of 10 for non-fatal MI in individuals with lupus, and a relative risk of 17 for death due to coronary artery disease. So that implies that the disease itself has a tremendous impact on increasing the risk for atherosclerosis, and our group has been trying to sort out what some of those risks are. Now in this slide, I'm thinking about, we're sitting in the clinics and we're sitting in our offices and we're seeing somebody with lupus, and we're saying, for this person, how much is the increased risk? How likely is this youngish woman sitting in front of me today to really have atherosclerosis? So I've chosen 3 studies that show you that. And the answer is about a third of women who have lupus who are around the age of 45 have atherosclerosis, not just an increase, they actually have it. So for